Hello, I'm Dr. Dennis McKenna. Today I'm joined by Jay Cahalan, President and CEO of Columbia Memorial Health. Welcome, Jay.
Thank you.
We're going to be chatting quite a bit here in a second. Today is Thursday, September 17th, providing you the update from Albany Medical Center. All right, let's begin with the COVID numbers. In the 8 counties of the Capital Region, which includes Columbia and Greene County, there are currently 24 people in the hospitals of those counties being treated for COVID. That number continues to be on the very low side. I think you mentioned earlier you have 1 in your hospital right now.
That's correct, 1 in-house.
Okay. Next graph are admissions and discharges to Albany Medical Center for people with COVID. Yesterday, 1 in, 1 out. And so for the third graph, it looks exactly like it did on Tuesday. We currently have 5 people in the hospital being treated for COVID, none on a ventilator. And Jay, when we were at our highest number, that number was as high as 80. So 5 is obviously a great number.
Yes.
I'm imagining down in Columbia and Greene and the counties that you serve, a lot of attention to making sure that people are doing all the safe practices to keep COVID reduced, yes?
Absolutely, absolutely. In fact, we've consulted with some businesses on safe practices in our local business district.
Very good, very good. Okay, so let's jump over and talk about Columbia Memorial Health. And the reason we invited Jay here today is as President and CEO, he represents really the first hospital that came into our health system back in January of 2016.
Correct.
And I know the conversations began before that with people like Jim Barba and Dr. Frisch. First of all, tell us a little bit about yourself, where you're from, and talk a little bit about, your role as it came up through the ranks at Columbia Memorial.
Sure. Well, I hail from Connecticut, as does most of my family. And I first came to CMH back in 1994 as the Chief Operating Officer.
Excellent.
And I was in that role for 18 years.
18 years.
18 years. And following that, I assumed the role of President and CEO. That was 8 years ago. I'm in my 8th year now with CMH.
Well, they picked a great person for that role. When we decided that Columbia Memorial and Albany Medical Center would become affiliates, what was the vision? What was the hope of why we would bring these 2 organizations together?
We already had several, I'll call them informal relationships on a clinical level.
Yeah.
And many of the practitioners and clinicians already had close care relationships where patients would be shared, and I think care was also beginning to integrate. And we really saw that we could help that along. And the affiliation really has done that. It allowed us to do some things technically that we otherwise might not have been able to do.
Right.
And we've been able, since 2016, to integrate several clinical services, which really was our aim. We thought that would be better for patients, better for care, better for continuity.
And of course I know which those are, and it's been remarkable to watch how this came together. But for the people who are watching in our workforce, can you pick 1 or 2 and talk about those clinical services that are more organized?
Sure. Well, a couple of the first, and they're very foundational to medicine, would be radiology and pathology, both diagnostic specialties that are incredibly important to any patient care scenario. And because we so often shared patients, this was a natural way to have the very same specialist care for a patient regardless of where the care was delivered.
Yes.
And it's particularly useful, obviously, in emergent situations where patients may first arrive at Columbia and then perhaps be transferred to Albany Med. Again, when those specialists and diagnostics stay the same, the care is really transformed.
That's great. That's great. When I had Angelo Calboni here earlier, I said to him, tell me some things about the Saratoga Hospital that you're proud of. And he said, there's not enough time. I'm sure the same is true for you. But if I gave you an opportunity to talk about a couple of things that you're really most proud of on your campus, what would you highlight?
Well, our campus is extremely expansive. We have, of course, a main campus that's in Hudson. We have a large campus in Catskill, and we also have a large campus in Volusia. But we also have many offices and services throughout Columbia and Greene County, and also one in Dutchess County. Mm-hmm. And what I think is remarkable is those 2 counties, from a land area point of view, and I like to use this comparative, it's actually larger than the state of Rhode Island.
Wow.
It's well over 1,200 square miles, almost 1,300. So we don't have a very densely populated area, and that presents challenges to care. And one of the challenges was met, frankly, by us providing access. In our region, and we have regions within our region, we have the mountaintop, for example,
Yes.
which is different from the 9W corridor.
Yes.
And is certainly different from the Berkshire area of eastern Columbia County. So in a way, I like to think of it as we really range from the foothills of the Berkshires right through into the Catskills. So it's an interesting area.
It sure is. And I know that you and I will be in a meeting later today, and we get a chance, obviously, to work together on a regular basis. So I look forward to that as well. But I just want to thank you for being here. Stay around, obviously, and jump in on any other topics. And let's have you back again so we can talk more about what happens on your campus.
Very good.
All right,
Thank you.
very good. A couple things to mention. There's a medical student investigation day coming up next Tuesday. That's from 9 a.m. to 4 p.m. This is pretty interesting. So our medical students put together academic posters of work that they've done. And then our faculty, sometimes as many as 200 faculty, will come and actually provide feedback to our medical students. We have 150 medical students participating in this. I'm one of the judges, and it's really fun. And the work is incredible. And they do outcome measures, they do quality, they do things like disparity, and they're very scholarly. And so I just want to call that out and thank Mandeep Sidhu. And he would like to thank Jean Bruno in Graduate Studies, who pulls this all together. So that's next week. We've talked about this before. We're an academic medical center. We have 3 missions: clinical, research, and education. And this certainly hits on all of those. Some great news. Today, the Times-Union reported that in the Capital Region Best Of, Albany Medical Center was named the best hospital, which is great for 2020. And that is obviously a reflection on our incredible workforce. It has been said that at our best when the region needed us most in 2020. So thank you to our workforce for that. That's an incredible honor for us. We're very proud of that.
Congratulations.
Last bit of news. Fred Venditti normally sits in that chair.
Yes.
And people may say, people have stopped me in the hall. They say, "Where's Fred? Where's Fred?" And I say, "Well, Fred has been home." And the reason Fred has been home is his daughter just gave birth to a baby girl. And so we want to congratulate Fred and Fred's wife, Dr. Ellers, is also a physician here on campus, and congratulate them. Baby's doing great. But Fred and I would often wear shirts and things together, and I think you wanted to continue that tradition.
Yes, having seen this
Yes.
Several times, maybe even watched a few reruns, I thought it would be important to bring along
Yes.
a small token of our appreciation and also a little bit of a remembrance for our interview today.
Yes, that's right.
So it's an official CMH, an affiliate of Albany Med baseball hat.
Well, I love baseball hats. I wear them all the time. When I'm not at work, I have a baseball hat on my head. This will be my hat this weekend.
As do I.
I will wear it proudly. Thank you. All right, we'll leave it on.
My pleasure.
We'll be back next Tuesday. I hope you come back with us again.
Thank you.
Sometime.
I
Thank you
will.
very much for coming. And
Thank you.
to your incredible team down at Columbia Memorial.
Thank you very much.
We'll be back again Tuesday. Over the weekend, for those who are working here, we thank you for the 24/7 coverage that you provide. And we ask that you once again, please take care of yourself, take care of each other, and we'll see you Tuesday.